Social distancing in many parts of Zimbabwe isn't easy. Victor CHAKANYUKA, like most Zimbabweans, has a casual job. But selling on the street, he's afraid of catching coronavirus. Public wash basins are being placed around the city, but cuts in the council's water supply means the taps run dry for hours, sometimes days.
Our country can't manage to cope with this pandemic disease. Maybe external countries might come and help.
Health officials say they are ready to minimize the impact of coronavirus should there be an outbreak. Wilkins Hospital is one health quarantine center in the capital where suspected cases are tested, but it only has a few dozen beds. The collapsing economy is adding to the problems of the struggling public healthcare sector. Launching the National Preparedness Response Plan on Thursday, President Mnangagwa said Zimbabwe has other health challenges to deal with.
With our HIV prevalence of 14% in Zimbabwe, or slightly below, and malnutrition and other non-communicable diseases, especially among children, we are deeply concerned about the impact COVID-19 could have in Zimbabwe.
Zimbabweans have some experience dealing with disease outbreaks. More than 4,000 people died from cholera in 2008. Measures were put in place to contain that outbreak, but the threat of coronavirus has forced the government to take action and implement more drastic measures, which include banning public gatherings of more than 100 people. The ban on public gatherings affects church services, weddings and sporting events for 2 months. While there is no travel ban, people from countries with confirmed cases of coronavirus are being discouraged from coming to Zimbabwe. Zimbabweans are being advised against traveling abroad until the pandemic is under control. Mandatory screening has been intensified at all ports of entry. The government says screening will soon be introduced at all its offices. But with the worst economic crisis in a decade, many public hospitals are understaffed and lack basic equipment and medicine. Some Zimbabweans worry about the lack of resources to deal with coronavirus if it spreads. But government leaders say they are ready and on high alert. Haru, Mutasa, Jazeera, Harare.